It's Tuesday, June 8th, 2021. I'm Jonathan Lowe, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today we're going to be looking at some clinical research out of the Journal of Anesthesia and Pain Medicine. The title of the article is Prolotherapy for Patients with Chronic Musculoskeletal Pain, Systematic Review and Meta-Analysis. This comes to us out of Seoul, Korea, and was accepted in October of 2020. The goal here, again, this is not actually ozone therapy, but we utilize ozone therapy alongside of prolotherapy very often. So the goal is to see how prolotherapy works and then talk about how ozone therapy might be added to that. So what is prolotherapy? First, really quick here on the background, prolotherapy stimulates the healing of loosened ligaments and tendons. It's a cost-effective and safe treatment for musculoskeletal pain and a number of other things I might add. But what I want to look at here is some of the statements in the abstract, but then go a little bit deeper into the study itself or the review. As you see highlighted here, it says prolotherapy yielded results similar to platelet-rich plasma or steroid injection, that it showed no significant difference in pain scores. So when we talk about chronic musculoskeletal pain, the most common injection, of course, is corticosteroid injections. There's issues with that, though, and we need to look for better ways to treat this type of thing. So how does prolotherapy work? Well, let's take a quick look right here. It says a local inflammatory cascade is initiated, which triggers the release of growth factors and collagen deposition. So a little bit of inflammation actually produces this effect in a way that helps to stabilize and heal a joint. Now, I'm going to breeze through some of this because it isn't pertinent for us, but what I want to focus on here is highlighted again under discussion. Our principal findings revealed that prolotherapy with dextrose has a clear and positive effect on chronic musculoskeletal pain ranging from 6 months to a year. Now, keep in mind, when we do these types of injections, generally speaking, it's not going to be a cure for these things for good. Now, there may be certain things, again, we're talking about pain right now. We're not talking about ACLs or osteoarthritis or other things. We're just talking pain. So what was the type of treatment regimen that they utilized in these various studies that they reviewed? Well, take a look down here in this summary. They use 3 injections. You can see I highlighted that here because I think it's important. And here's the various prolotherapy solutions that were used, but 3 injections was the most common. 3 injections, these are various studies that were done. 3 injections here, 6 rounds of injections, so 6 injections, 3 every 21 days, 6 every 2 weeks. So you'll see that from every 2 weeks to every month is very common as far as the spacing between the injections, and that from 2 to 6 injections is very common as well. We have 20% dextrose, 15% dextrose, 25% dextrose. Along with lidocaine, oftentimes you'll see in these studies that's used. So that's the solution that was used. That's the treatment regimen that's often used. And you'll see the effect of pain relief in prolotherapy was seen within 3 to 12 months. So that's the kind of the window. In contrast, it says prolotherapy has no serious side effects and effective, safe, and sustainable. So we're kind of contrasting that with corticosteroids and some of the issues there. And then this statement, both PRP therapy and prolotherapy commonly have regenerative therapeutic properties, but the central mechanism of prolotherapy and PRP are different. In prolotherapy, hypersomal dextrose triggers an inflammatory response, increases platelet-derived growth factor expression, and upregulates several metagenetic factors that may act as signaling mechanisms in tendon repair. In PRP therapy, it aims to augment the natural healing process of tendon repair and regeneration by delivering high concentration of growth factors into a lesion. Prolotherapy can provide more convenience to both patient and treatment providers because it's cheap, it's fast, and it's easy. So at the end of the day, dextrose prolotherapy has been shown to have a positive and significantly beneficial effect for patients with chronic musculoskeletal pain.